back. The month of March marks colorectal or colon cancer Awareness Month. And here today to talk about it is Dr. Chanel Bagwenden. Thank you so much for being here. Doctor, you're with the medical director of the Gastrointestinal Surgical Oncology Program. A mouthful there, Jupiter Medical Center. Thank you for joining us once again. Really important topic to talk about. And you and I were chatting during the break. The one thing I said is, isn't unfortunately colon cancer sometimes detected way too late? And you said that's why we're here.
Yeah, absolutely. You know, it really is the awareness. Certainly, the majority of patients, when they have colon cancer, don't have symptoms or even colon polyps, which are the precursors to colon cancer. But oftentimes, when patients start to develop symptoms, that's sometimes when it's too far invasive into the colon or potentially even spread elsewhere. But certainly bringing awareness is key, and making patients aware of those risks and what the statistics are with colon cancer to identify, one, if they're at risk, but two, bring awareness to the fact that this is a preventable cancer, and that's why we're discussing it.
And so talk a little bit about Jupiter Medical Center's kind of approach to colon cancer.
Yeah, so Jupiter takes a patient-centered approach. So it's we do a multidisciplinary conference to review cases where patients may be diagnosed with colon cancer, ultimately to review the pathology, make sure the diagnosis is correct, and then ultimately get them on a personalized treatment plan. With surgery, we tend to utilize a lot of robotic surgery, so minimally invasive, a focus on quality of life, and what we call an enhanced recovery pathway to get patients home quicker with their family. Jupiter Medical Center has also started, as of last year, next day appointments. So if a patient is diagnosed with a colon cancer, they can see an oncologist next day and just start that pathway.
And nothing is worse than hearing those stories of someone finding out the horrible news that, hey, you know what, your life is changing. We'll see you in 3 months, you know?
Right,
so to have that next day appointment is a big deal. Let's talk about preventative measures. So when should someone watching right now, what age do you get a colonoscopy?
Right, so the guidelines and recommendations support age 45 for average risk patients. So if you have a genetic predisposition or a propensity to develop polyps, that's something that obviously needs to be discussed and lends itself to earlier screening. But average risk, age 45, if you have a colonoscopy at age 45 and it's clean, no polyps or anything, then typically the recommendation gets spaced out to 10 years.
Okay. Now, you see a lot of commercials about those at-home tests. So talk about those because, you know, in our busy lives, and obviously a colonoscopy, people don't look forward to those, right?
Fair enough.
And you'd probably rather go to the dentist, but at the same time, you have this possibility of doing some kind of a screening at home. So what's the thought process?
I mean, the message here is that this is a preventable cancer. It's the second most deadliest cancer that we see in adults between men and women. So ultimately, we have to put that risk into context. And when we talk about, let's say, the mantra that's out there is the best test is the one that gets done. So there are less invasive, inexpensive tests that are sometimes even over the counter, and they're geared more towards either detecting DNA related to colon cancer in the stool, blood in the stool, things like that. But ultimately, and a lot of providers will tend to favor colonoscopy as the gold standard because it will not only detect diagnosed colon cancer, but if treated early, prevent it.
Okay, so 45 is that magic number unless you have, you know, obviously a family history, but any test is better than nothing. So it's always about preventing. Thank you so much. Knowing that we have all these resources right here in our own backyard is very helpful. If you'd like to learn more here about March being Colon Cancer Awareness Month, you can go to our website. We'll have this interview up so you can share it with your family and friends, but also a link to how you can make sure that you are taking the proper steps on our website, WPBF.com. Doctor, thank you so much.
Thank you.